Hi, my name is Devin Wallace, founder, CEO of Wallace Ventures Medical Sales and Consulting. Today, we are going to be talking about alternative pharmacy career pathways for pharmacy technicians. Faculty disclosure, I declare no existence of financial interest in any amount related to the content of this activity. Advisor board members and other individuals not previously disclosed who may review, propose recommendations, and/or edit the content of PharmCon CE activities declare no existence of a financial interest in any amount related to the content of this activity. Learning objectives. At the conclusion of this activity, participants should be better able to identify alternative career paths for pharmacy technicians, explain the difference between certification and certificate, list training and educational opportunities for alternative pharmacy careers, provide examples of training and education for alternative career pathways. Overview. The expansion of pharmacy technician roles and responsibilities has opened many new career pathways, which can be found outside the traditional community or clinical pharmacy sector. These new alternative career paths for pharmacy technicians often require additional focused training and education. In this activity, we will discuss non-traditional pharmacy career pathways for pharmacy technicians and some of the training and education required to break into these alternative pharmacy careers. Alternative career pathways for pharmacy technicians. There are many out there. We'll only cover a few, but as the industry is growing and more responsibilities are given to pharmacy technicians, this list is ever growing. One of these would be medication access, which would be patient care or engagement coordinator. 340B, working with manufacturers to bring medications at low cost to patients. Insurance contracts and licensing audits. Automation, pharmacy automation technicians. Technicians who are working with PCSIS machines, working with medication dispensing, and in some cases, a hybrid of working with IT and working with automation, such as coding. Procurement, inventory management, supply chain management. As it's gotten hard to get a hold of medications and supplies, supply chain management has become a big focus. The just-in-time ordering of medications and supplies has become irrelevant almost as COVID has expanded and taken over globally. And now pharmacies and distributors and manufacturers are having to make more products, keep more products on hand to meet the demand. Information technology, to be integration specialists working with PCSIS, with Omnicell devices, could also include integrating new software and technology into a pharmacy or IV room. Consultant, oftentimes when these new systems are being installed into facilities, there has to be some type of follow-up, maintenance, and oftentimes IT professionals who have a pharmacy background will work as consultants in assisting in keeping these technology systems up to date, and if there are problems, of course, working to get them back online. Code writers, with new technology is being added to pharmacies in sterile and non-sterile environments, the robotics are involved or the automation needs to be written. And what better than have a pharmacist or pharmacy technician or someone in that field who understands what needs to be done, what needs to be added to these systems. And oftentimes, professionals with a background in IT or code writing can find a very relevant job currently with automation and IT. Regulatory and compliance. Quality assurance has become a big focus for pharmacies, including the FDA. With the rise in 503B facilities and 503A compounding facilities that are on a larger scale, quality assurance is becoming a major focus. Budgets are becoming increased to hire professionals for quality assurance, in particular in the 503B industry. Hazardous drug designated person. With USP 795, 797, and USP 800, the hazardous drug designated person will become an increasingly large role. Once USP 795 and 797 are complete, USP 800 will be enforceable across most states and in the future across all states, more than likely. There are some states who are currently enforcing USP 800-like standards, and hazardous drug designated professionals will become an abundant position. Operations. Pharmacy operations lead, supervisor, and manager. Increasingly, pharmacy technicians are finding themselves in lead, supervisor, and managerial roles. Being able to operate a pharmacy at its highest effectiveness is leading to more and more technicians finding educational opportunities to become a lead or a supervisor or a manager, and more technicians are starting to fill those roles instead of pharmacists. Education. Instructor roles, either with online or community college, has become very relevant as pharmacy technician programs are popping up and will increase as more technicians are going to be seeking national certification, and states are asking for pharmacy technicians to become certified and licensed or registered. Content writer or technical writer. For those pharmacy technicians who have been in the industry for a long time, they have a lot of knowledge in particular areas, either compounding, being non-sterile, sterile, or hazardous drug, or working with and training pharmacy technicians coming up, and will find themselves with the opportunity to become a content writer for an organization or technical writer for a private company. Device educator. As more devices are being made available for nurses, for pharmacy technicians and facilities, there's going to be a need for device educators. Going to a facility and showing staff how to use a particular piece of machinery, such as a IV pump. Marketing, web page, and e-commerce. Pharmacy technicians are able to find themselves in a role with compounding pharmacies or pharmacies in general across the nation now, as there are more facilities who are looking to advertise and expand their business. Having a pharmacy technician who has a background in web page development or marketing greatly helps and expands their ability to go out, market new customers, and bring in new patients. It's much more difficult for a web page designer who has no knowledge of the pharmacy industry to build websites or complete marketing for pharmacies, as many organizations have to meet FDA guidelines when they are marketing. So it is much easier for facilities to find technicians who have a pharmacy background and understand the laws when it comes to marketing of medications. Veterinarian. This is a market that many technicians aren't aware of. For those who don't like necessarily working with humans on a day-to-day interaction, they may find that veterinarian is a better space for them. In the veterinary space, just like anything else, there's compounding, cells, regulatory and compliance, and in some cases, patient care. A pharmacy technician who is looking to work with animals can also work at getting a certification as a veterinarian technician. They may be dual certified as a pharmacy technician and also as a veterinarian technician. When it comes to regulatory and compliance, their compliance and regulatory is quite different than the human market, and some pharmacy technicians who have come previously from the veterinarian field may find that they have a better understanding of those rules and laws. And as USP is changing and some states are adopting USP, they are also mandating that veterinarian clinics and hospitals also come up to USP standards. This is new for veterinarian and often challenging, and this is a great space for pharmacy technicians to expand into, having previous knowledge of the human compounding world, but also if they have a understanding previously coming from the veterinarian space. Cannabis industry is an ever-growing market. Some states are legalizing it, putting it on their ballot every year, and more states have legalized it recently. There are legal, regulatory, and compliance opportunities for pharmacy technicians in this field. There is not a lot of educational content on the legalization of cannabis, but laws have to be written for legalizing medical and recreational. And in some instances, like Minnesota, pharmacists and pharmacy technicians are the ones who can dispense cannabis. Sales is a great opportunity for those who really like to work with people on a day-to-day interaction. There are plenty of opportunities in sales, not only dealing with sales of compounding, but also devices, equipment. And in some cases, there are products that are used for educational purposes. Companies who make products for education and will sell it to long-term care facilities or even compounding pharmacies who sell with a large patient base. This could include account manager. Often this is going to be your typical sales rep, sometimes inside sales or outside sales. Inside sales, you aren't going to have a lot of interaction with your customer on a face-to-face value. But if you are an outside sales rep, you will have the opportunity most likely to travel the country. Acute and clinical sales representative. As pharmacy has expanded, there are more opportunities for organizations to expand their organizations, which gives more opportunities to technicians. One area that would be included would be compounding. More 503Bs have popped up in the nation, and you must be able to go out and sell your product. And oftentimes, hospitals who are not able to compound particular medications or not able to do it in volume will look for outsourcing facilities. This would be a great opportunity for pharmacy technicians who have a previous background with hospital systems, acute care, or specialty to become a sales rep. Manufacturing. Outside of hospital systems and traditional retail pharmacies, 503B industry, they compound medication on a large scale. As I said before, they make medications not patient-specific, so they are able to batch medications in large quantities and then sell them to pharmacies. This is a great opportunity for pharmacy technicians who want to work in a fast-paced environment, who necessarily don't want to have a day-to-day interaction with the customer. With these positions, oftentimes you will find yourself in a manufacturing type environment where you would go into a compounding room and you'd make medication on large scale, anywhere between hundreds to thousands. Product compliance. Many manufacturers make products or are developing products to meet the demand of the expanding pharmacy market. This is a great opportunity for pharmacy technicians with an understanding of state and federal regulatory guidelines on what products would best fit certain markets, either being veterinarian or the human industry. A good example of this is as USP 797 is moving forward, we're going to see more sterile products inside of clean rooms. The garb that is worn must meet certain guidelines, and manufacturers in many instances are searching for individuals who understand the laws and what needs to be built into their products to be compliant. And then 3D manufacturing. This is an exciting field that many people don't know about that will continue to expand over the next few decades. 3D manufacturing or 3D compounding is the ability to take multiple medications and print them into one tablet. It's a very interesting industry. Currently, it is being tested and used in the European market. There is one pharmacy in the United States who currently manufactures 3D printed drugs. With 3D printed medications, the complexity that is normally involved with either compounding medications will be greatly reduced, because you will be able to take multiple medications and turn them into an oral form that normally wouldn't be able to be made into an oral form. With the 3D printing, once again, this is an opportunity for anyone who has possibly a IT background, a robotics background, or understands the compounding industry well, and will give them an opportunity to move into the next echelon in the future of pharmacy. There's not much information about 3D printing other than a handful of companies out of Europe and a few that are in the United States, but many large printing organizations like HP have been making making the products to make medications for 3D printing for some time. Also with 3D manufacturing, with the supply chain issues, you will start to find that more manufacturers are 3D printing their products. We saw a large rise in this when COVID hit and there were not enough face masks and eye shields, face shields for personnel. Many organizations across the United States started to turn their attention to manufacturing these products with 3D printers. Continuing education and training creates growth. So there are different ways of obtaining education, and I want to make sure that everyone understands how this is broken up. Certificate and certification. I want to make sure that folks understand the big difference between certificates and certification. They are alike in some ways, but there is a fairly large discrepancy between the two. Certificate typically is a single course for newcomers demonstrating a basic knowledge of a specific focus. Often you will be able to take a CE and get a certificate. You may go to a college and take a class, and at the very end, you may take a small test demonstrating that you have knowledge of a specific item. And that course may not necessarily be nationally certified. It just may be a course that a facility has designed and then offers a piece of paper which says that you've completed their program. Most often, this document that they give is awarded by a for-profit educational program or institution. As I said, there are CEs that are out there that will oftentimes offer a certificate. There are private entities who will also offer a certificate of completion. Oftentimes, these certificates may award a designation, which is added to the end of your name. Certification, often awarded by a standard-setting organization or third party, or often a non-for-profit. A good example of that would be PTCB, having industry standard across the nation for what pharmacy technicians should know and the skills that they should have going into the pharmacy field. And oftentimes, there is an initial assessment, an exam that has to be taken before you can call yourself certified in that particular field. Often with a certification, there is an ongoing educational and demonstrative requirement to maintain that certification, to recertify. In some instances, you will have to recertify every 6 months or every year or every few years to maintain your certification. The subsequent exams that you must take to recertify are not as intense as the initial exam, but will provide either new information or act as a refresher to make sure that you are continuously staying up to date with the industry. Often demonstrates a higher knowledge, skill, and competency in a particular specialty. With the different certifications that are being offered throughout the nation, some of these specialties we'll talk about have to deal either with compounding specifically or with IT, and in some cases, project management. This also is most likely to award a designation, which is added to the end of your name. And as a reminder, both can be completed online or in person. Previously to COVID, many organizations require that you came in to their facility and took their courses or took their testing on site. As COVID has moved through the years, has progressed, organizations have had to move around to make it easier for applicants to be able to take these courses and testing online. Many now are allowing pharmacy technicians and other personnel to take these tests online instead of having to go on site. So some of the pharmacy certificate programs are out there, and by all means, this is not a complete list. This is a list that I've compiled over the years, and it is ever expanding. You have Apexis, which has a 340B operation certificate program. The 340B program, because you are dealing with a federal program, it is very difficult for some folks to understand. And thankfully, there are some organizations now who have certificate programs available. Apexis, I know, has been kind of the industry standard for a lot of folks throughout the industry. ASHP, they have a pharmacy informatics certificate. This is great for pharmacy technicians who are looking to break into the pharmacy IT industry. This is going to give you a better understanding of hospital informatics, and the potential there is kind of unlimited in the IT world. Many programs and certificates that are available will just add on top of something like this. But this pharmacy informatics certificate is specific to pharmacy and is great for pharmacy technicians looking to break into those roles. PharmCon has immunization, pharmacy Spanish specialist, and in the near future, a regulatory compliance certificate. Regulatory compliance is becoming a bigger and bigger issue throughout the nation for compounding pharmacies as state boards are increasingly doing inspections and are being educated by FDA inspectors about what to look for. Pharmacy Spanish specialists, of course, very important for a lot of the technicians who have face-to-face interaction with customers. And I would highly recommend that anyone who is looking for a pharmacy program for learning the basics to Spanish for pharmacy, this would be a great program. And there are a couple of others out there that are available. Critical Point has a certificate program for sterile compounding. They were the first to kind of come out with a certificate program for compounding, and it has evolved. PowerPack has a veterinarian certificate, is very in-depth. And for those pharmacy technicians who are looking to get into that industry, I would highly recommend taking the veterinarian certificate program. Humans and animals are very different. And when it comes to making adjustments for doses or for making adjustments into the medications that are being administered to different animals, the mechanism of action is very different. So I would highly recommend that if you are looking to get into the veterinary industry, that you would look into taking a program, a certificate program like this. Medication therapy management, MTM. There's a lot of organizations who are starting to get into medication therapy management. It's something that has evolved over the last decade as roles and responsibilities for technicians has expanded. You'll often find this in retail and acute pharmacies, but now you'll also find this in the telehealth industry. So for those looking to work from home, this would definitely be a certificate program that you'd want to look at. PTCB, the Pharmacy Technician Certification Board, and the new Board of Pharmacy Technician Specialties, which is part of MPTA, they have very similar programs. Pharmacy Technician Certification Board was the first to come out with many of these. This would include technician product verification, medication history, controlled substance diversion prevention. This has become an increasingly important emphasis for many organizations, sterile and non-sterile, and in the veterinarian market. Hazardous drug management, again, it's something that is expanding for pharmacy technicians, and pharmacy technicians will find themselves with the opportunity to lead and be managers overseeing operations for hazardous drug. Billing and reimbursement, everyone wants to get paid, of course, so this is great for pharmacy technicians to have an opportunity to master and prove that they have mastery of that skill. Immunization administration, as COVID has increased, almost all states are now allowing pharmacy technicians to administer immunizations, and I believe that this is something that will stick around for a long time. So this is a great opportunity for all technicians to go and take immunization administration program. Point of care testing. Point of care testing is performing a diagnostic test outside of a laboratory. A good example of this would be rapid COVID tests. Once again, as COVID expanded, pharmacy technicians had to help fill the role and the gap that was happening. Nurses were being pulled away and were having to be at the patient bedside more. And pharmacists were already spread pretty thin. So pharmacy technicians now have the ability to often get certificates in point of care testing. Medication therapy management, MTM. As I said before, this is a great opportunity for pharmacy technicians. This is where pharmacy technicians will assist pharmacists in collection of patients' medical history and also helping patients get off of medications that are similar duplicates and reduce the amount of medications that they are taking. Regulatory compliance, as I said before, there are a lot of opportunities for regulatory compliance. This is going to be a field that will continuously expand. Pharmacy technicians are filling these roles. Before, pharmacists were often in charge of these specific jobs, but pharmacy technicians have proven that they can be in charge of regulatory compliance, and we are seeing more organizations hire pharmacy technicians to be in charge of regulatory compliance. Supply chain management. As it is becoming harder and medications are becoming more expensive, facilities are looking for personnel who can find medications at the best price, make sure the inventory is low, but also that you're not running out of medication, and to will and deal with manufacturers. There are many manufacturers out there, and most organizations only work with the big three. With a supply chain management, this greatly reduces the costs to a facility, which can reduce costs for a patient by having someone who's going out and searching for the best price. When it comes to pharmacy certifications, Pharmacy Technician Certification Board, the PTCB, rolled out the CSPT, Compound Sterile Preparation Technician. The CSPT designation for pharmacy technicians has given them the opportunity to prove themselves that they have exceptional knowledge when it comes to compounding, which of course has made pharmacists more comfortable having technicians with a CSPT. The Advanced Certified Pharmacy Technician with the CPhT Advanced. This program, you must take a series of courses to garner this designation. In some cases, getting the CSPT with 3 other certificate courses that are offered will grant a Advanced Certified Pharmacy Technician designation. Critical Point has developed multiple programs, and 2 that have come up many times and state boards are starting to take acknowledge of is the qualified person for 503A and qualified person for 503B. The Critical Point Qualified Person Program is a national credentialed program providing individuals the knowledge and skills to plan, develop, and operate a 503 or 503B operation. As a qualified person, you become the point person for regulatory agencies when they come in to do audits, investigations, or just general visits. More and more pharmacy technicians are finding themselves in this role where they are the point person when regulatory agencies show up. Previously, organizations would go to the pharmacist and make them the point person, but oftentimes now pharmacy technicians are filling that role. Another pharmacy certification would be through the Accreditation Commission of Healthcare, ACHC, the Hazardous Drug Designated Person. Again, this is a program that is going to be more and more relevant as states are enforcing USP 800. The ACHC Certified Consultant is a newly generated program. This is for organizations who have ACHC accreditation and are preparing for their accreditation. Consultants will essentially do audits and give feedback to facilities who are preparing to get their ACHC accreditation or reaccreditation. Board of Pharmacy Technician Specialties, the BPTS, they have 2 programs, certifications that they've created, one for sterile compounding and another for non-sterile compounding. Again, this is fairly similar to PTCB's sterile compounding preparation technician, but they also have a certification for non-sterile. And there are many non-sterile compounding pharmacies out there. This is a great opportunity for pharmacy technicians to prove themselves in their knowledge base and mastery of non-sterile compounding. There are many opportunities for pharmacy technicians to go out and get certificates or certifications that are non-pharmacy specific focused. When it comes to project management, looking at job postings throughout the nation, something that often would pop up was project management. Oftentimes you'll find this for individuals who are in leadership roles, in integration roles, such as in IT. Some of these certificate programs that are available, you have the Certified Associate in Project Management Professional, and there are many others that are out there depending on what the primary focus is. Sales and customer service and marketing. Anyone who's looking to be in the sales industry, anyone who's looking to work in the IT industry will often need to have an understanding of CRM. CRM is an automated collection software program for companies to intake information and take care of their customer by following up or through sales. So CRM is a customer relationship management software. There's also a certified professional salesperson certificate that is available, certified sales executive. Anyone who is working in the sales industry, I would highly suggest that they look into becoming certified or taking courses for CRM. There are many that are out there. You just Google in CRM and you can find all the different organizations that are out there and often certificate programs that are available. Inventory management. There are courses for inventory management and certificates. There's a certified in production and inventory management and certified supply chain professional. Organizations who are looking to either train or technicians who are looking to get into these advanced roles and really want to stand out against others should look into some of these certificate programs that are out there. As I said, they may not be pharmacy specific, but it will give you a very good idea of how supply chain works. Analysis. For pharmacy technicians who are looking to be in an IT role or business management, necessarily working on the day-to-day operations on the floor, kind of be behind the scenes, there are certificate programs that are available. Two of those would be Certified Business Analyst Professional and Agile Analyst Certification. For IT, there's a long list of of certificate programs that are available for pharmacy technicians. I could make a million slides for these, but A+ certification is geared more towards hardware. So when you are bringing in new automation or new machinery, having A+ certification will greatly help. It will give you an understanding of how computers work. Cisco, Citrix, the software programs are available. There are many others that are out there, but some of these are the major certificate opportunities for pharmacy technicians to take with Cisco and Citrix. And then UX, user experience. Organizations who work with customers online will often need to maintain a good operating system. This is an opportunity for pharmacy technicians to get involved and learn how to make a usable system for customers to easily navigate and maneuver websites or to access programs. CAD, for technicians who would like to be more involved into the IT world and are looking to work with mechanics, robotics, CAD design is a great opportunity to get in and use your previous knowledge as a pharmacy technician, or if you have experience in engineering prior, this also lends its hand to 3D manufacturing of medications or 3D manufacturing of equipment and disposables. Quality, process, and safety. Lean Six Sigma, it has become largely used for large hospital organizations and sales companies. But we're starting to see it on a smaller scale too, that organizations are looking to have pharmacy staff who have a background in Lean Six Sigma. Lean Six Sigma or Six Sigma is about identifying opportunities to alleviate extra steps in a process, to increase efficiency, but also to find root cause analysis when there are errors or there is a problem. This can be used in multiple different areas of pharmacy, including compounding, management, manufacturing, sales. Quality validation. With the changes of USP 795 and 797 and 800, compounding facilities are needing to meet these new guidelines. And with that is the increase in ensuring that the quality of a product is to the highest standard. There are more organizations who are starting to hire quality validation personnel or quality assurance personnel. Getting a certification in quality validation or quality assurance is a great opportunity for those who are looking to try something new but have a high attention to detail. HAZWOPER. This is something that would be for safety. As USP 800 is starting to come into play in the future, this is something that pharmacy technicians have a great opportunity to get into quality or into safety. HAZWOPER comes from the industrial and construction world, but is increasingly being utilized and seen in the pharmacy field. A good example of this would be programs that OSHA offers, including the HAZWOPER. For those who are looking for the hazardous drug designated person, I would highly suggest taking a HAZWOPER program. This will give you a lot of background and detail about how we've gotten to USP 800, the reasons why, and how to work around or work with the regulations that are coming. Other additional learning opportunities that are available. Community colleges often have programs or have courses that may relate to pharmacy. Oftentimes you will find this through workforce development. These are kind of offshoot programs, evening or night courses for individuals who are trying to get a little bit of a head up in their industry or gain better knowledge. There are more and more community colleges who are offering pharmacy technician courses, either in sterile compounding, non-sterile compounding, or hazardous compounding. Often these courses are non-college credit, so you will not obtain credit for taking them, and they also will be non-CE. They may not be ACPE certified or certified for other healthcare industries. Internal. For companies who have sponsored training classes and courses, this has become more and more relevant as personnel are becoming more specialized and have a deeper background in education. Oftentimes there are technicians or pharmacists who will offer CEs for specifically to their own company. And this may be used for compounding if they want to have an in-house program. This may relate to working with customers. It's kind of unlimited. Also internally is mentorship. This is something that I believe that every organization should put more of a focus on, and I think that we see more and more of it happening now, is teaching individuals within your own organization, mentoring them for roles that they want to work towards. Pharmacy technicians who do not have a compounding background, who want to learn about compounding, can easily be mentored internally within an organization, trained, and then can go out and get certified themselves. Professional organizations. The Center for Pharmaceutical Cleaning Innovation, CPhT, has a great program for all healthcare professionals who want to learn about cleaning validation, testing, environmental monitoring. Regulatory Affairs Professional Society, RAPS. This organization has multiple certifications. There are some that are specific to the healthcare field. It's just about finding which certification works best for what you are going towards. With conferences, many of them do not need to be pharmacy focused. Early in my career, I went to many conferences that were not pharmacy related, but dealt with the industry in some way. A good example of this would be veterinarian conferences, manufacturing conferences, packaging and sales conferences. This is a good opportunity for anyone in the pharmacy field who wants to expand and kind of open up your mind. Go to some of these conferences that you believe would give you some value that you could add to your pharmacy career and new opportunities that are available. And then the online offerings. There are many that are out there. Some that I have seen and I've told others that they should look into. Udemy has many online courses for the medical and pharmacy field. Harvard, MIT, believe it or not, actually have courses that you can take, which is phenomenal and great. You're getting top tier education, and these are online. One in particular that I was interested in that I had signed up for a long time ago was for 3D printing industry, 3D manufacturing. So there are many opportunities through these organizations online In some cases, you do not have to pay to take the course. edX and Coursera are two other online programs that are up and coming, but do offer a small amount of courses for pharmacy or the medical industry. And then Lyceum. Lyceum is a great source for pharmacy technicians who are learning to have a deep understanding of compounding and the step-by-step process to it. They are constantly adding new certificates in CEs that you can take. Some of them are non-accredited CEs or just courses that you can take. Anything from gloving to the process of compounding medications. So just to give an example of some of the alternative career opportunities that are out there, looking at the jobs that are available, oftentimes it is great to look and scroll through and see what they want you to have for that particular position. So one of the major ones that comes up often is operations manager or supervisor operations. In this role, it is often that you will see that they are asking that you have a Six Sigma background, either Lean Six Sigma or Six Sigma. This is primarily focused on efficiency, and that's why you'll often see operations manager. They want to see that you have that type of background. Project management as well. You have to think that as a operations manager, operations supervisor, you're going to be working with projects possibly on a monthly, possibly on a weekly basis. The introduction of new training processes or the introduction of new machinery, new software. You have to understand how to schedule out how you're going to perform those tasks, how you're going to utilize your staff, what you need to complete your task. And project management is a great tool to have in your pocket as an operations manager. Another great one would be pharmacy regulatory specialist. I do see that regulatory background comes up often. As an operations manager, you're dealing with internal and external issues. What I mean by external is that you're going to be dealing with regulatory agencies often. Internally, as a pharmacy, someone with a regulatory specialist background, you may be looking at how do we operate our clean room? How do we store our 222 forms? Are we, through our audits, are we doing the correct things? Regulatory compliance or regulatory compliance specialist is what I often see pop up, or regulatory compliance consultant. Often you're going to see that they do want you to have some type of regulatory specialist or regulatory certification. Regulatory affairs certifications are available, and just like pharmacy regulatory specialists or those other certifications, this one's going to go a little bit more in depth, more in detail about dealing with the large players, the FDA, the DEA. Having a compound sterile preparation technician certification as in regulatory compliance, if you are the designated person of a facility, this would be extremely important to have. If you are just in regulatory compliance, not dealing with sterile compounding, this wouldn't be as important. Drug diversion, if you have multiple facilities or you have a large facility and you have a lot of controls that you are either working with, dispensing, having a drug diversion certification would be extremely important and would be helpful, especially when you are going to be dealing with FDA, DEA, state boards on a regular basis. Quality assurance, having a regulatory certification would be extremely important to this position. You have to think that you're going to be dealing with the DEA, FDA, state boards of pharmacy on a regular basis, including other organizations if you were in the veterinarian field. Project management would also lend its hand to this position. In often case, you will find that they're asking you to have a project management background. This is because as a quality assurance person, you are going to be looking for and identifying issues in quality. And if something does come back, you need to be able to investigate and then build a plan of action. We're seeing more and more that organizations don't have personnel who understand how to build a plan of action when there's an issue identified, and then document it correctly. This would also lend to having a quality validation certification or certificate. Inventory management. Having a Six Sigma or Lean Six Sigma background in inventory management would be extremely important. You have to be able to keep a very tight budget and stay lean, but you also have to understand how your suppliers work, and having a Six Sigma background is going to lend heavily to this position. For compounding pharmacies or pharmacies who deal with large quantities of controlled substances, a drug diversion certification would be important to have. This is going to give you an in-depth understanding of all the regulatory and compliance that deals with handling controlled substances. In inventory management, having a background or a certification in supply chain is going to be extremely important. This will separate you from the rest, but also give you a better understanding of the industry as a whole. In some instances, I have seen for inventory management positions that a business analyst certification has been asked for. This is because of the large quantity of money that is going to be exchanging hands, purchasing and distributing medications. As you know, many of these medications can cost thousands and thousands of dollars, and the budget is extremely high. Being able to account for how much money is being spent, coming in, coming out, is very important. For those looking to get out of the healthcare field and with humans and move towards the veterinarian industry, drug diversion certification is something that is constantly being seen. And that is because prior, the DEA did not have as much influence and oversight into veterinary compounding. More and more veterinary compounding is moving into the regulatory field of human compounding in the human market. So there is a large focus now on the drug diversion aspect. Compound sterile preparation technician. For those who are looking to be compound pharmacy technicians in the veterinarian field, I would highlight that they get they have a background in compounding and have a certification. Veterinary compounding is very similar to human compounding, but can also be more complicated in the fact that the dosages are either smaller or much larger. You have to think that a dosage for a human who's 250 pounds compared to a giraffe, a rhino, or a whale are much different. So having a compound sterile preparation technician background would be extremely important due to the cleanliness of being able to maintain these environments, which are usually difficult to maintain. In a veterinarian certification, understanding how medications work with animals and different animals are extremely important. Particular medications for a cat could be lethal to a dog and vice versa. Also, dosage forms, the way that medications are given. Oftentimes, if a medication cannot be given orally, they will use systemic action by using drops that can be applied to the eye or the skin. Pharmacy medical sales. It is extremely important if anyone is looking to get into the pharmacy medical sales world that you have an understanding of customer relationship management or CRM programs. As I said before, there are many that are out there, and almost every organization across the board is going to want you to have some experience with a CRM. Certified professional salesperson. This is something that is newer to the industry, but it will help lend to making sure that you are one step above everyone else who is looking to get in this industry. It has great information about how to deal with customers, how to deal with day-to-day business, and how to find different sales techniques to go after new clients. Oftentimes, organizations will want you to have a deep understanding of business. Having a business analyst certification in medical sales is essential. You have to, again, think that you are going to be working with large quantities of money between distributors, sales, coming in, money going out. Being able to account for and to budget appropriately are extremely important. Designated person. There could be multiple certifications that are for this, or there may only be a few that you should have when you are looking at becoming a designated person. Regulatory certificate, without a doubt, should be something that you should have going into becoming a designated person. If you're working with hazardous drugs, you'd of course want to have has Cert for hazardous drugs. A great example of this would be some of the OSHA programs similar to the HAZWOPER. As a designated person, a quality certificate would be extremely important, either with quality assurance or a quality certificate. As the designated person of a compounding facility, a compounding certificate or certification will greatly lend its hand to your day-to-day operations and understanding. Information technology, across the board, organizations are asking for individuals to have a background in hardware and software, either a certificate or a certification. These are always changing, so there are plenty out there that you can find, particularly to the industry you're going into. Project management across the board, oftentimes they are asking for a PMP. You have to think on a daily basis that you are going to be planning out and scheduling what you will be needing for implementation of a new product, rollout of a new design or product, software, or updates to hardware machinery. In information technology, you will also be dealing with a CRM on a day-to-day basis. CRM is going to help you keep a lot of information into one space. This is going to be dealing with customers, emails, text messages. This is also going to help you with your planning, scheduling. If you have vendors, that you're going to be able to keep all the vendors that you are working with in a file, and in often cases you will be able to do sales through these applications. The key takeaways: the field of pharmacy has expanded over the last 2 decades with the introduction of new rules, regulations, technology, and expansion of pharmacy technician roles and responsibilities. This expansion of pharmacy has created new opportunities in non-traditional pharmacy fields, which require pharmacy technicians to continue to evolve. Through additional training and education, these alternative career paths open pharmacy technicians to explore alternative career options.